Stroke victims are being denied their dignity. Horrific failings in care, a report in 1999 claimed. The stories that you read in this book range from 2001 to 2012. Have lessons been learnt? The study by the Royal College of Physicians and Patient Charity, the College of Health, found that stroke victims are being denied vital treatment, rehabilitation services and support for relatives. One-to-one interviews with stroke victims and their carers revealed that many were left depressed, frustrated by the lack of services. Some had even attempted suicide. A catalogue of complaints include diagnostic mistakes, delays in getting to hospital and receiving treatment, criticisms of clinical care, patients being treated as stupid, patients not being fed, taken to the toilet or bathed. Campaigners said the report showed horrific failings in the level of care provided for stroke victims. The report was commissioned as part of the production of National Clinical Guidelines for Stroke Rehabilitation. For the first time, patient view taken into account by researchers and have been incorporated into guidelines which are set to be published later this year. The study will make recommendations about staff training, better information about strokes for patients and carers and new patient-friendly guidelines. Patients from across the country were interviewed about their experiences in hospital and after being discharged following stroke. The report found that many stroke victims were not treated in dedicated units but were left in geriatric or psychiatric wards. Patients who were treated in specialist units praised their level of care, but those in general wards were often left with poor quality treatment. They were not given prompt or adequate access to vital services such as physiotherapy or speech therapy. One woman whose husband had a stroke while they were on holiday in Austria told of how in a foreign hospital he was bathed every night and had constant access to physiotherapy from the time he was admitted. When he returned to an English hospital he was given a bath once a fortnight and did not see a physio for a month. Patients who were unable to speak were not washed and went without drinks because they could not communicate, they reported. And on being discharged, victims felt they were left to cope alone without adequate resources, knowledge or support. Services like speech therapy and access to social workers or counselors stopped abruptly, and often elderly women were left to cope virtually alone with their severely handicapped husbands who had had a stroke. The report recommendations included, hospital staff needed more specific training in dealing with stroke victims, including how to communicate with them, and more knowledge on therapy, support and personal care. Patients and medical staff should together draw up an individual written program of care as soon as possible after admission to hospital. There should also be a written plan of care for patients after they are discharged, with information on local services and arrangements for monitoring stroke victims after they leave hospital. There should be assessment of the practical and emotional needs of both stroke victims and their carers and relatives. The need for a more systematic nationwide approach by health authorities to ensure equality. The need for patient access to clinical guidelines so they can see exactly what treatment they are entitled to. Although we are not surprised by the results of this report, we are pleased that other organizations are adding their voice to the Stroke Association's call for better services for people affected by stroke. A horrific failing of stroke care is revealed. The reports show that something needs to be done, and urgently. Around 100,000 people a year fall victim to a stroke, the third biggest killer in England and the single main cause of severe disability. Neil's story. I'm Neil, 29 now, and my adventure started in November 2000. It was a Sunday afternoon, 3 o'clock, went to the toilet. When I came down I couldn't talk. Eventually went to Sale Oak Hospital. The doctor took my blood pressure, it was 185/112. He panicked and thought I had had a stroke. Eventually I was admitted. I had no other symptoms other than this speech problem. Monday kept having regular blood pressure checks, still sky high, although my speech had fully returned. Tuesday I finally got to see a consultant, Mr. Waite, by name and nature I suppose. He thought it could have been a stroke. And got sent later that day for CT scan. By this time I was getting bored and missing my 2-year-old and wife. I was getting up every morning and helping nurses serve food and make beds. Friday Mr. Waite came back to see me and ask about my lifestyle. Don't drink, don't smoke, keep fit, a bit of money worries, debt, the usual stuff. At this point he said, we are worried about you at your age and having stroke isn't very good. You need an MRI, but there is a bit of a waiting list, so you have 3 options. These options were, 1. Staying as inpatient for 3 months and get MRI. 2. Go home for 9 months, have MRI but can't work till sorted. 3. Pay me £900, have MRI tomorrow. So I waited in as inpatient, got very bored, eventually had MRI and went home in late December, I think. Bloody stroke knackered my memory. When I got home I realized still have not started any medication, took about 3 weeks to sort that out. Anyway, the 26th of September 2002 I woke up feeling sick and phoned in sick to work. I went to be sick in bathroom and collapsed. I was then only 28 years old, lost the use of my left hand side and total speech. My GP wouldn't come out and insisted my wife takes me to him. I got paraded through the waiting room like a freak show. He took one look, sent me home and called an ambulance to my address. Why? Anyway, after 2 days got everything back enough to go home, and the new consultant was convinced it was not a second stroke, but he was also concerned about this episode and told me not to drive for 6 months. I was a car delivery driver covering the UK. I have since lost my job because of insurance difficulties. He wanted to send me for a lumbar puncture test, so I waited at home for about 5 weeks, still no appointment or medication. Anyway, after lots of complaints, got an appointment in November to see him. This time he was very sure I'd had a stroke and was surprised I was not sent for an MRI. Enough said. I could now go back to work, or in my case find a job, but I didn't know what to avoid, neither did he. It's now 21st of January 2003. I have just had my lumbar puncture and my MRI, and now I have to wait another 5 weeks or so for results. So I could be a time bomb ticking away, not knowing what to avoid to not have a third stroke at the age of 29, and in both occasions have not received any medical attention for my stroke for 3 months after the event. This can't be safe. The benefits agency was a joke. Immediately after discharge I rang the benefits agency. 3 hours later got through. I told her my circumstances. She said, get another job. Jump to 2024, it's getting worse in the UK. More than 157,000 victims, including those who suffered from a heart attack and stroke, have been left waiting for more than an hour for an ambulance, despite experts saying that every minute counts for heart attack and stroke victims.